Hi everyone, welcome back to my YouTube channel, Nursing with Beatrice. Today we'll be looking at a topic, diabetes mellitus. I don't want you to confuse it with diabetes insipidus because that one has to do with problem with antidiuretic hormone. So just the urine, the fluid part where the patient is just losing fluid, that's diabetes insipidus. So we'll look at that in another topic. But for today, diabetes mellitus has to do with problem with glucose metabolism, where the body is not able to metabolize glucose properly due to the problem with insulin, either with the production of insulin or with the utilization of insulin. So this insulin is a hormone secreted by the endocrine function of the pancreas, by the beta cells of the islet of Langerhans. So when they produce insulin, insulin is supposed to do some function. One, it helps to convert glucose to glycogen and store in the liver. So when you eat, insulin is stimulated. It's stimulated to act on those glucose and convert excess because it knows that the body will not utilize everything. So it converts the excess to glycogen and store it for future use, like a spare. And also insulin helps to transport the available glucose to the cells where they need it. So it transports it away from the blood to the cells for proper use. But when there's a problem with this insulin, either in production or utilization, there will be hyperglycemia, because as long as insulin is not able to work on those glucose that have been produced when you eat, it means the glucose will be flowing in the blood. And when it's high in the blood, we call it hyperglycemia, high glucose in the blood. Then we have types of diabetes mellitus. We have type 1 diabetes mellitus, we have type 2 diabetes mellitus. And I also touch on gestational diabetes. So diabetes type 1 has to do with deficiency in production of insulin. So either may be very little or no insulin that is produced at all. So these ones, they would depend totally on insulin for the rest of their life. So another name they call diabetes type 1 is insulin-dependent diabetes mellitus or juvenile onset diabetes mellitus, because it happens in the younger people, basically people below the age of 30 years. And it's spiked between age 11 to 13. It's not like you can see it in older people, but it's more with children. That's why they call it juvenile onset diabetes mellitus. So like I said, in type 1, there's no insulin at all. This could be an autoimmune something. It can be due to maybe genetics. It can be exposure to some environmental factors like virus and all that. Now, type 2 diabetes is more due to insulin resistance. So in this one, insulin is being produced, either not enough or there's resistance. The insulin that is being produced is not able to bind properly to do its work. So we say there's resistance to insulin. Then gestational diabetes, just to touch on it, this one happened in pregnancy. It has to do with those hormones in pregnancy, like estrogen, human placenta hormones. Those hormones that regulate pregnancy, when they impede or kind of stop the action or reduce the action of insulin, then the patient can develop gestational diabetes. So what are the risk factors for diabetes mellitus? So these risk factors are listed here is more for type 2. Type 1, the basic cause of this type 1 diabetes is most times is unknown, like I mentioned. But for type 2, the risk factors include obesity, so inactivity. If somebody is too fat and there is high cholesterol, there are those fatty deposits, it can lead to insulin resistance. Then we have hyperlipidemia, which is high cholesterol in the blood. So this can impede insulin function. Then we have hypertension. It can be genetics and even race like the African Americans, the Hispanic people, even American Indians. So they are more at risk, especially African American, they are more at risk of developing diabetes mellitus. So what are the signs and symptoms of diabetes mellitus? So the first one is what we call the classical sign of DM. That's the 3 Ps. We have polyuria, polydipsia, polyphagia. So polyuria has to do with producing excess urine. Polyphagia has to do with excessive hunger. Polydipsia has to do with excessive thirst. So why does this happen? So we know that water loves glucose, so it pulls fluid along through osmosis. So when there is high glucose in the blood, there will be what? Fluid will be attracted to the glucose, and that goes along with it. And once it exceeds that tolerance by the kidney, about when it's more than 180 milligram per dl, then the patient will begin to lose those glucose in the urine, and there will be so much fluid that will be pushed out. So that's where we have polyuria. So they urinate a lot. And because they are urinating a lot, they will feel thirsty because they will feel dehydrated, right? So because they will feel thirsty, we call it polydipsia. They want to drink water just to replace those excess fluid loss. And then polyphagia, that excessive hunger, that's because the cells that need those insulin are not getting it, that need those glucose are not getting it because insulin is not able to properly transport those glucose to what? To the cells for use. So in a way, the body is sensing it that there is no enough glucose. The body is kind of starved, and then they will keep feeling hungry. Even the more they eat, still those glucose will just be flowing because it's not being carried to the cells for use. So hyperglycemia, like I said, when insulin is not able to convert those glucose, or either take it to the cells for use or store some of them in the body, the patient will be having excess glucose in the blood. Glycosuria, that's glucose in the urine. That one is because of those excessive glucose that is flowing, and it exceeds the ability of the glomerulus to excrete to filter. So they begin to escape to the glomerulus, and then the patient urinates it. So another one is dehydration. Because of that excessive fluid loss, they become dehydrated, and then the skin will be dry and will also be warm. Weight loss. So this weight loss is more common though with type 1 diabetes. Even the polyuria, polydipsia, polyphagia is also more common with type 1 diabetes. That's because that glucose is not being utilized by the body. So of course they will lose weight. As they are losing fluid, they are not getting, the glucose is not properly absorbed, then they will lose weight. Fatigue and weakness, that will also fall back to that weight loss. And then delayed wound healing. So a patient that has diabetes has so much glucose flowing in the body. So when there's a wound and all that, the wound will not heal properly. So that's why we try as much as possible to encourage patients that have diabetes not to even sustain injury at all, because there'll be delay in wound healing. Infection, they are prone to infection because those microorganisms, bacteria and all that, they love glucose. So when a patient has high glucose, they are at risk of infection. Acetone fruity bread, this one is common with type 1 diabetes. So it's unique to type 1 diabetes. That's because there's basically no insulin that is there to do the job of working on the glucose. So because of that, the body will fall back to fat, which is what we call lipolysis. It begins to break down fat. As it's breaking down, I convert it to fatty acids, and then those fatty acids, they are being converted, broken down to acetone, which is acidic in nature. And then the patient, you could feed that fruity bread. It's more observed when the type 1 diabetes get to a level where they are having DKA, diabetic ketoacidosis. I'll look at that in another video, so you want to check out that. And just before I continue, please, if you have not subscribed to my YouTube channel, please encourage me by hitting the subscribe button. Thank you so much. And then another one is blood vision. So this one are more like a later problem with diabetes mellitus, especially when they are getting close to some complication of diabetes, which I will look more in another video. So they could experience blood vision, which is what we call like retinopathy, when they get to that stage where they are experiencing problem with, seeing properly. Paresthesia, tingling sensation. So they experience this tingling sensation in their hands, in their feet, and all that. So let's see how to diagnose diabetes mellitus. So they basically use blood tests. The first one is fasting plasma glucose. If it is greater than 7 millimole per liter, or is greater than 126 milligram per dl, or a random plasma glucose greater than 11.1 millimole per liter or greater than 200 milligram per dl, on two separate times. So they don't just conclude with one test. So if they do it 2 times and it's the same, it's this high, then they diagnose diabetes mellitus. Then there's also oral glucose tolerance test. They use this one more for gestational diabetes. So they do that around between 24 to 28 weeks gestation. They want to test for gestational diabetes. They can give the woman, they ask the woman to drink 50 grams of glucose. If it is high, they ask them to come back and give them 75 grams of glucose. So if the test and is still greater than 200 milligram per DL, then it's diagnostic of diabetes. Then there's what we call hemoglobin A1C. So this one assesses the pattern of glucose in the system for a period of 2 to 3 months. If it is greater than 6.5%, it's suggestive of diabetes mellitus. Treatment. So the treatment of diabetes mellitus depends on the types. For type 1 diabetes, they call them insulin-dependent diabetes mellitus, so they are dependent on insulin for the rest of their lives because there's no insulin at all. And we don't want their body to rely on breaking down fat for release of energy, because that would lead them to ketosis and all those diabetic ketoacidosis and all that. So they put them on insulin continuously for the rest of their life. And as they're taking insulin, we also encourage them to do exercise, because it's like one shot of exercise is like one shot of insulin. So when they do exercise, as if they are also taking insulin. So we encourage them to do exercise, and the diet is also important, because those before now, type 2 diabetes mellitus, they call them adult onset diabetes mellitus. But now they are beginning to see children come down with this condition because of their eating habit, their lifestyle and all that. So diet is also good. It's also important in type 1 diabetes. But the most important is insulin. They have to live with it for the rest of their lives. Now for type 2 diabetes, diet is important. Anti-diabetic medication, what we call other hypoglycemic medication, are very important. And exercise is also very important. So they place them on anti-diabetic medication. I'll look at that in another video. So you want to check that out. Then diet, type 2 diabetes can be managed with diet. Remember, diabetes is a chronic condition. So they live with it. It's not like once they take this medication, it disappears from their system. No, but they can manage it to a level where they may not even feel those symptoms, especially in type 2 diabetes, with diet. So they need to see their nutritionist, their dietitian, to check with the food they eat. Reduce sugar intake. It's so important. Watch their diet properly to ensure that they are not taking too many carbs. So they are not to eat large carbs, large food at once. They take it in smaller quantity, but they eat frequent also. So they have to check their diet and eat healthy. Very important. Exercise also, they have to be active to help, because these are some of the risk factors in the first place for type 2 diabetes. And then if these are not properly managed with medication, with diet and exercise, then they can also support them with insulin. So let's look at patient teachings. It's very important for patients that have diabetes mellitus. We want to teach them on what to do and what not to do. So the first thing is food care. It's very important that they inspect their food on a daily basis, because they have decreased sensation to those lower extremities. So if they develop ulcer or any wound or any injury, they won't know. So we teach them to inspect their food. They can use mirror to check on it properly for see for any wound or anything at all, cut or anything. And then there should be no tight fitting shoes. No, because they could develop injury from tight shoes and they won't know. And that could lead to amputation with time, because if those wounds are not properly healed, they can develop diabetic ulcer that can lead to amputation. So part of using shoes is checking for objects. So when they wear their shoes, we teach them to take that shoe, raise it up, shake it properly, ensure that there's no sharp thing in it or any object at all inside the shoe that can injure them when they put their legs in it. So they always inspect their shoe, check it properly for object or anything before putting it on. Another thing, they should not go barefoot. They should always make sure they are with shoes. You don't want them to match something that will cut their leg, put injury there and all that. So, and no open toe shoe. They should wear closed toe shoes, shoes that are properly covered so that they are not exposed to injury. Then when they are caring for themselves, let's say after shower, after washing their feet, they should dry properly, dry in between the toes. And also they can apply moisturizers on the feet, but they should ensure that in between those toes, there should be no moisturizers, because we don't want infection to develop from in between those toes. And then when they are cutting their nails, they should cut it straight, because we don't want them to cut it round, because they could develop ingrown nails from there. So they should cut their toenails straight. And a good advice for them is, possible they should use a specialist to cut their nails. If they can afford it, a podiatrist can help them trim their nails properly. But if they can't afford it, we'll still teach them how to cut it straight. And then if they have any wound, no matter how small, any injury at all, they should not just start treating it at home. They should come seek their healthcare provider, seek for their healthcare provider advice and in follow up with the treatment. Wound care specialist, a wound care nurse and all that should be the one treating their wound. They shouldn't be doing it by themselves because they are at risk of infection, their wound doesn't heal properly. So it should be done by a specialist, by an expert, so that they can heal properly from it. So that wraps us today's topic on diabetes mellitus. If you find this video helpful, please like, share this video with others, and subscribe so that this channel can grow. Thanks for watching.